Hi, my name is Maria and I'm a Master's Counseling Intern at UHCS. Today I'm going to be briefly talking about Major Depressive Disorder, what it is, some of the common symptoms, a few of the different expressions of Major Depressive Disorder, as well as some of the common treatments. The DSM-5, which is a diagnostic tool used by professionals, describes Major Depressive Disorder as a period of at least 2 weeks in which an individual is feeling either down or a loss of interest in things that used to be enjoyable. Additional symptoms include changes in appetite or weight when an individual is not trying to diet, slowing down of physical movements that's noticeable by others, feeling tired, fatigued, or exhausted. Oftentimes people with major depressive disorder might get more than the 8 hours of sleep and feel exhausted, get fewer than 8 hours of sleep, or despite getting the recommended amount of sleep, still feel tired and exhausted throughout the day. Additional symptoms include feeling worthless or excessively guilty when it doesn't match the situation, an inability to concentrate or make decisions, as well as potentially thoughts of death or suicidal ideation. These symptoms cause significant distress or impairment across different domains of life, whether it's at work, at school, at home. And these symptoms aren't due to another mental health condition, medical condition, or substance use. There may be differences in how major depressive disorder is displayed or exhibited based on a variety of factors, including gender and culture. For example, women are socialized to internalize things more, whereas men are socialized to externalize things. So this may lead women to exhibiting more symptoms of sadness or inappropriate guilt, whereas men may be more likely to show signs of anxiousness or irritability. In addition, those with minority gender identities, sexual identities, those in minority groups in general are experiencing discrimination and minority stress, which can worsen symptoms of depression. Depression may also be exhibited differently based on an individual's culture or background. So for example, some individuals are more likely to have physical complaints, so saying that they have frequent headaches, having frequent stomach aches, feeling tired and exhausted, and stating I'm sad is less likely. These are just a few of the ways that major depressive disorder can look different depending on an individual's background, and these certainly aren't the only ways, but I think these examples show that although I listed some of the common symptoms, the symptoms that are listed in the DSM-5, there is a variety of ways that major depressive disorder can express itself, and there are a lot of different ways that people can also seek help for major depressive disorder. With COVID-19 increasing isolation and disrupting many people's daily life, people with pre-existing major depressive disorder may be experiencing worse symptoms, and people that haven't experienced symptoms before may be experiencing them for the first time. Staying connected with others, whether that's in person or through technology, at this time is vital for people in managing these symptoms, as well as recognizing the symptoms in oneself and in other people. There are still plenty of options for help and assistance at this time, and I'm briefly going to go through a few of the ways that major depressive disorder is often treated. Medication is one of the common ways to treat major depressive disorder, or at least relieve the symptoms in conjunction with therapy. Antidepressants are a common type of medication that's used to help relieve symptoms. They can help restore emotional balance and help people with their day-to-day life. Therapy is also a very wonderful option. There are so many forms of therapy that are used in treating major depressive disorder. Generally, a combination of antidepressants and therapy are the frontline treatment for major depressive disorder. I highly encourage you to check out the UHCS YouTube channel for additional videos on coping skills and other information that may be useful for those with depression, as well as the Facebook page for additional information. Again, for students at UW-Whitewater, UHCS is a great resource, and at the end of this video will be a phone number you can call to set up an appointment with a counselor. Take care.